What's up, guys? Welcome back to another clinical conversation video. If you're new here, my name is Dr. Brian Larish, and I'm the owner of a cash-based physical therapy clinic, as well as the creator of the PT Growth Academy. And in today's video, we are discussing the topic of posture. This could be anything as patients saying, my posture is bad, I need to improve my posture is causing pain. And I really wanted to make this video because I find that I'm having these conversations all the time with patients, and it's really an education moment. And I hope that what I tend to educate patients can be of value to you. The first thing that I do when someone is bringing up posture is, once they're finished, ask them, what do they consider good posture to be? And at this time, typically it's an upright military posture. So we'll see patients immediately come from a more of a slouched position to an upright position. And then I'll say, okay, so if that's good, what is bad posture? And then they typically go to a slouched over position. This is our first education point, and that is the best posture is the one that you can move in and out of. When you can't move in and out of postures, that is a pattern. Patterns create pain, postures don't. Think about it. If somebody is stuck here, they're going to have just as much pain as someone that's stuck here. When someone doesn't have the ability to move in and out of variable postures all day long, they're going to have pain. They're going to start to compensate. All these compensations add up over weeks, months, years, and then we develop a pattern. And our movement variability, if we think of a movement scale, starts to diminish. So anytime we have a task that we need to perform that is outside of this movement, we compensate. We compensate through lumbar extension. We compensate through hiking our hip. We compensate by orienting the whole pelvis. There's a lot of different ways that we compensate. But when it comes to educating patients on posture, I think we need to address the very first question that I said, which is the fundamental basis of it. How do we comprehend, and what is our mindset as to what good and bad posture is? Once they hear this, it's a little bit of a sigh of relief. And it becomes a aha moment, like, oh, wow, like you're right. Because a lot of them go in this position all day long, right? If they are working from home, if they have a desk job, a lot of them say, I try to have good posture all day long and I have pain. And it's the act of forcing the body, it's the act of lack of movement that's creating the pain. So what I typically tell them is, I want them to be here throughout the day. I want them to be here throughout the day. I want them to be here throughout the day. I want them to be here. I want them to be moving. When it comes to improving someone's posture, when it comes to getting someone out of pain relating to posture, it's movement that's going to do it. It's not exercises to train them to be stuck in this military upright posture. And I think it makes sense. And I'm hoping as you're hearing this, you're kind of like, oh yeah, maybe I didn't think of it like that before. But hopefully as we're going through this, it's making more sense. And what I hope is that the next time a patient comes to you and brings up any sort of posture related topics, whether it's from a pain standpoint or an exercise standpoint, we first educate them on what is good and bad. We start to change their behavior, their thoughts on posture, and a lot of times we can start to get them out of pain. Yes, genuinely changing posture does take a lot of time. Think about it. If somebody's in a pattern and they've been in that pattern for years, they've learned how to move in that pattern. They've learned how to breathe in that pattern. They've learned how to compensate in that pattern. So there's a lot of retraining that needs to take place. But to me, starting at the fundamentals and making sure we have the right mindset when it comes to changing posture is the key to really successfully changing it long term over the course of specific exercises and movements that's specific to that patient.